Max. Been doing a great job there. Thanks everyone for taking the time out to come to the workshop as well. We've got quite a few people on board actually, so there's around 45 people that's on the participating today, so that's a really good number. Thank you very much for that. Yeah, so like Max said, this is where we hear from you guys, the TIS teams that are out there. Especially around this time, COVID time, and there has been some challenges, but also there's been some really good success stories, innovative ways on how our teams have been operating. So I might ask the teams just to give a little bit of a feedback on how they've been going, some of the, like I said, some of the challenges, but also some of the success stories. So I might start off with Kira. Kira from Danila Dilba. How are you going there, Kira and team? First of all, who's in the room there with you?
Can you hear me?
Yeah.
So I've got Jenon, myself, Alex, and Rod in the room with me.
Hi everyone. Okay. So how have you been going up there in Darwin?
So Darwin has been pretty lucky. It hasn't fully stopped us, which has been really good. I guess one good news story is that Alex has finally joined us, so it's good to have an outsider to be able to get out and do more programs and engagement with the community. I'll let Alex say hello and introduce himself.
G'day everyone, my name's Alex. I've joined the TIS team here at Danila Dilba about 4 months ago. I'm really enjoying it. But yeah, thank you very much.
Welcome to the TIS family, Alex.
Thank you.
I guess COVID for us here at Danila Dilba, it's allowed us to be involved and create more program resources for our rehab groups and for our young groups that we're targeting. And the program itself has been well received already. We've been able to run, I think, 3 successful programs already during that time. So that's been really good. And along with the COVID stuff, we've been able to engage a lot more with our homeless mob. And conversations have now started around their smoking and drinking and not sharing smokes and all that kind of stuff. So we sort of walk around in the mornings when we get here and just make sure they're all right. So it's been really positive for us.
That's a really good idea. Hey, just when you're walking down the street, and just run into any of our mob, and you can, just, give them the message right there and then on, particularly, like we've, Tom had mentioned earlier about sharing smokes even, around this time and everything like that. So that's really good to hear. Great work there. And I know that's sorry, go on.
Oh, you're right. Yeah, it's been really good, really positive, building really good rapport. So it's really, really awesome stuff that we're doing during this time.
Thanks for that, Kira. And I'm sure if anybody else had any questions for Kira throughout the workshop, they can chat, or if not, get in contact with the team up there at Danila Dilba. So let's go down south a little bit to Katherine West, and I'm going to ask Jessica the same kind of thing. How are you going during COVID, but also, what are some of the challenges and some of the successes that you've been going through there?
Thanks, Desley. Before I discuss that, I just want to introduce Michelle. Michelle's just started with Katherine West, and she'll be taking on my role as the Tackling Indigenous Smoking Coordinator. I'm actually leaving Katherine West in the next week or so and moving across to Wurli here in Katherine and starting up the TIS program there, which is exciting. We also have recruited Matika Rockman, who is a Gurindji and Walpuri lady within our region. So she's just ducked out at the moment, but I'm sure she'll pop in and say hello. So during COVID, that was a bit of a hard time. Being well, our office is based in Katherine and our communities are in a different biosecurity area. So we couldn't actually get into our communities, and our organisation kind of classified our program as being not as essential as some of our other services that we provide. So we weren't allowed to travel out until those biosecurity areas had shut down. Even to this day, Katherine West has quite a strong procedure on reducing the number of people that go out into community, so our program staff, just to make sure we're not carrying any germs out there and protecting our mob out there. So I suppose during the whole COVID, we're working from home. So we had to really rely on social media a lot to get our messages out there. I did focus on a bit of TIS, but my role kind of shifted to a little bit COVID overall. But I suppose we also had the opportunity to slow down and catch up on paperwork that we haven't been able to do because we've been so busy in the bush. So we've developed 8 TIS education session plans. So we've made little packs. So when the TIS team go out, or if they go out with our mesh team or our child health team, they can go out and take these resources packs out with them and deliver these educations in groups with the activity. We got that sorted, and we've really taken the opportunity to link in with our stakeholders a lot more. So we have 3 stakeholders we're currently working with their smoke-free work policies and getting some signage in place. So we've been working with Outback Stores, who run the store out at Niparu. So we're currently working with them, and we're also working with in Yarralin, the Wollongari Aboriginal Council of the store. So we're going to make that whole store smoke free and have a policy in place for that organisation. And the last one is Anyinginyi Corporation out at Kalkarinji. They're recently taken over the Kalp pub, so we've been working in partnership with them to make sure they have a smoke-free management plan in place for their liquor licence, and they've also just got the funding for the new Children and Family Centre. I believe one was implemented on the east side. They've just implemented one in Katherine through Kalano, and there will be one out in Kalkarinji. So they're going to make that whole development area a smoke-free area, which is fantastic.
Man, that sounds fantastic. All right, that's really good, and it's great to hear that you're making, those partnerships with other places outside of the TIS program. And of course, as we know, it'll have that ripple effect then around the communities. Yeah. No, that sounds really good. And congratulations, Jessica, on your appointment at Wurli. Yeah, it'll be great then at Wurli to have somebody there that can sort of just hit the ground running. Yeah. Very good. And welcome to the TIS family, the other team members there. Very good.
Michelle and Matika.
Michelle and Matika, yeah, thanks. Okay, let's go is it across the road or up the road there to Sunrise Health Service? And Tanya, how are you going there?
There we go.
Yeah.
Sorry. Yeah, across the road. Hello, everybody. I'm good, thank you. I'm the only one on board this morning because some of our guys are in training today. So one of our team leaders is away sick and 2 are in training. We've got a new team leader who is amazing, done a lot of work in community. So he's been a great asset. And we have a supervisor to sit underneath me that will be starting in September. She's coming from Queensland, so she'll have to do some isolation when she gets here. But yeah, so the team's building and we're recruiting for some more community-based workers as well. But so with the last 6 months, as Katherine West, travel was restricted into the biosecurity zone. Some of us only got our permit the week before the zones lifted. So that made it, and I was one of those, so that made it really difficult because some of you might know I only started in February, so I hadn't actually got around to meet all our team. So it was quite difficult communication with them when they hadn't even seen me live. So we started doing some Zoom meetings, but that was a bit complicated also because some of our team don't have laptops. They just have their desk computers, so they didn't have cameras. So we're addressing that at the moment and getting some cameras out there for them so we can continue with those Zoom meetings because that's really important. Unlike Katherine West, Sunrise kept operating through that time. So we all still the head office is still working from head office. So we've continued that. Anyone that's got a bit of a sniffle has to work from home, of course, but otherwise we've kept business as usual. So during that time with the biozones, we sent big boxes of resources out to our guys and to make posters, some ready-made resources, but also lots of stationery and stuff to make really cool posters. And they translated those into Creole and hung them in the shops and in the clinic and all around town, all around the community, and handed out some resources. We got some soap off generously. Katherine West gave us a lot of soap, so we handed that out at the shop, talked about, you know, not sharing butts, sharing drinks, social distancing. We put the markers on the floors in the shops to try and promote the social distancing. So yeah, they were really busy during that time, still trying to get out and about, talking about tobacco and alcohol and other drugs, and but also the COVID messages. We were very fortunate to be able to get an educator out into Nooka before the shutdown. So the guys out there had a month with an educator, which was great. And then she travelled to Minyeri and Bullman and did some work out there as well. So we've really concentrated on getting our guys upskilled with e-learns and really improving their IT skills over this time. So currently we have them, the certificates are just flying in, a lot of insight e-learns. So upskilling our guys has been really, really important over the COVID time as well. So lots happening, lots of restructure in our Communicare system. So we've changed a lot of the templates to make it a lot simpler for our community-based workers, combine some templates and really concentrating on getting our guys to enter that data so that we're getting some data, because that's been a real issue for us as well as everybody else, going on what's been said this morning, but really concentrating on trying to get more data into the system on every point of contact. So we have our Communicare expert coming to talk to them in September for a whole day of training in data entry and how we gather data and enter that into the system. So the next 6 months looks exciting. We're bringing our team into town for a week every month, which the logistics of that are an absolute nightmare. But yeah, so for different types of training and upskilling them. So that's what we're all about at the moment, upskilling our guys so they're more effective in their jobs out in community.
It sounds like you've been very busy, and it's great, those resources in language. I heard a message around COVID-19 and language, and it's just so good to be able to spread that word around in language, so people do understand, as well.
Yeah,
so yeah, any resources, of course, and this is for everyone else as well too, any new resources, send them through to us and we can share them on the Yarning Group Facebook page, or of course on TISRIC as well too. We're all about sharing and caring and promoting the good work that you guys are doing there too.
well,
Thanks for that, Tanya.
Not a problem. Thank you.
And Justine at Miwatj. How yous going there?
Hello.
In that beautiful part of the country, I might add.
I know the weather is amazing at the moment. Like a few of the teams as well, we weren't, I guess, that we were affected, but we were in a biosecurity bubble as well. So our teams did have to work from home. They weren't able to travel into Nhulunbuy into the office itself. So although it was challenging, I think it was really good to reset with our teams and reconnect with each other and improve our communication with each other to let everyone know what we were up to, and somewhat kind of empowering for our local Yolngu people because they took ownership in, I guess, caring for their community and making sure that they were leaders in community kind of education. So there was, teams that worked from their backyards over the fence, doing consultation over the fence to ringing up the homelands where they're originally from and kind of working with different houses to talk about smoke-free spaces, which was great. Our community workers did a lot of work with the clinics around COVID and messaging for that. We had soap deliveries as well, which was great. So yeah, it was good for them, like I said, to take ownership and to help the community, not just with talking about sharing gnarlies, but to be able to talk about the hygiene around COVID, which was great. One of our biggest things we did during COVID was work with the schools because I guess we're in biosecurity bubbles that we were able to still go with the schools and do a lot of the healthy lifestyles activities with the sport. And we had kind of permission to do that, which was great. So we were able to target youth throughout COVID. And another success story is around our smoke-free spaces with our AFL in the region. So we're a big sponsor of that and making all AFL games throughout Miwatj region smoke-free. And the Nhulunbuy Town Square has just gone smoke-free again. Well, trying to get that more implemented, which has been great. And another thing we did well, I think, during COVID time was work on our social media engagement, being able to really, I guess, get out there on different notice boards throughout community and be able to share our messages around not sharing gnarlies and kind of giving up or quitting for lung health. Yeah, so the guys did really well. I think we actually had more data collected and more engagement throughout COVID than normal times. So...
That sounds really good. Got to collect that data, don't forget.
I know.
That's good. It's great to hear someone, having a yarn over the fence. So I can just imagine that, just picturing that too. Again, another good way of, getting the message around. Yeah, sounds really good there, Justine. Okay.
You don't mind me jumping in, Delcy? Hello, it's Gordon from Darwin.
Well, hi, Gordon. How are you?
I'm well. I'm stuck in Darwin at the moment.
Okay.
Miss travelling out to the region, but data collection is kind of my part, so I just thought I'll jump in. So for this reporting period, we kind of looked at 51 new homes, and which is really impressive despite the lockdowns and doing it through the fence line and through the phone.
Yeah.
And what we've noticed too, our last reporting and this reporting, is that we're maintaining about 20% of homes being smoke-free. So that's kind of stable around the 20% mark at the moment. People trying to go smoke-free, some drop off again, which is the drop-off rate is around less than 10% at the moment, what I can see here. But we're going strong on that, and that's really good. And the guys in the communities, they really want to drive it and to take ownership of that. And the same with the schools. So during COVID, we actually saw about 500 students in 3 different communities. And some of the schools even invited us to do the World No Tobacco Day events at the school. So we found that very encouraging and just very positive feedback from community.
Awesome. Very good. It's a different way when you've got local people talking to, especially we've got a few elders perhaps working up there in the team that are particularly for our younger ones, and they can see that message coming from someone older, and of course somebody they may even be related to as well too, and have got that really good connection there. So that was what I really liked about Miwatj, is that community people taking up that baton on getting that message out to their own mob, so yeah, it was really good, very encouraging too. numbers there. Great, thank you, Miwatj team. Cindy at Nganampa. How are you going there, Cindy?
Good, thanks. We were one of the groups that were actually seconded to work on the COVID stuff. We were in a biosecurity bubble. So probably the first weeks of the pandemic, when we actually spent a lot of time going organisation for the first 10 days, talking to them about what COVID meant for them and how they could work or not work and personal security. And then we spent the next 3 weeks going house to house, actually talking to each family group about COVID and explaining it, but with a TIS focus, always emphasising great time to quit and not sharing cigarettes and things like this. But we actually spoke 5 communities, every house in the community and everybody. So we made sure that everybody, and another group of people did the other 2 communities. We made sure everybody understood what COVID was. We'd done a whole lot of development of posters, and messages. At the end of that period, we had a lady that had some video skills, so we made 3 COVID videos, which included one on not sharing smokes, butts, ganja and cool drinks, but one on social distancing and one on hand washing, and so they were in language using local people. And just because we were there, we actually got them to do some filming for the World No Tobacco Day, because we planned to do that on Facebook because it was very difficult to do displays in the communities. So we did, we invited all schools to participate. A lot of the teachers were away on holidays and only just coming back because of isolation or not back yet. So we only had 3 schools participate. But we got a really good tobacco rap song out of that, and we put the videos with it, and that's been shared on our Facebook site and on the TIS Yarning page as well. So we've been working really hard with a COVID but TIS focus as well. So we've maintained that all throughout, and we've used Facebook a lot more. I've probably travelled a lot more than I've ever travelled, and visited a lot more houses than I've ever visited. But the community was really, really grateful that people were doing this and that they were getting the correct information. So that was really good. We were also working on signage to go outside the community. We've actually got the signage done, and it's a local community artist who's done a signboard about not smoking in the houses and around children and cars. And we've got that done and here, but we were waiting on permission to put it up. And because of movements, we've still been still waiting for that to happen. But it's actually on the lands. We've just got to get it out to the communities and be put up. But all the resources are here to do that. We've also, we've been working on doing a lot of the ferrying of COVID stuff around the community, because they're trying to limit who travels still amongst communities. So we've been delivering soaps as we were going around doing other stuff, delivering soaps to the stores for free, delivering refrigerators, because we're actually testing sewage for COVID here as well. So we've got that started. So we've been taking refrigerators around to the communities. So we've been doing a mixture of COVID and TIS stuff all together. And our World No Tobacco Day went well. We got 2 songs out of it, one really good one and one was average, but still nice because the kids were involved.
Yes, I saw that. It was on the Facebook page.
Yeah.
Oh, that was so good, Cindy. Those kids did a great job. So if anybody's missed that, I'm sure it still would be up on our Facebook page.
It is, and lots of good posters. And we actually got a little one school group concentrated on smoking and pregnancy. So we've got a little book that we give to the pregnant now, which has got the kids' photos about not smoking in pregnancy. So we hand that out to every pregnant woman. And we've just been involved in the circuit evaluation, trying to do it via Zoom and through the TAFE Centre, which has been very, very problematic, but we've managed to get through it, trying to organise focus groups and things. So it's been difficult, but interesting.
Good. Thank you for that feedback, Cindy, and great work out there for you guys. Really good. Tennant Creek, is Dan there? Sorry, Dan, I can't see you.
Yeah, I'm here.
Okay, I don't think I've met you, Dan. Did you want to introduce yourself? And
Yeah, hi everyone. My name is Dan, and I'm the Tackling Indigenous Smoking Education and Communications Officer. I work under Rihanna, and we work for Anyinginyi Health Aboriginal Corporation. So yeah, when the guidelines and the advice from the state government was introduced, Wurli-Wurlijang Aboriginal Council ran a return to country program, which saw a huge decline in the Indigenous population in town. And since the TIS team is part of the public health section of Anyinginyi, we just used the section's COVID-19 awareness campaign to deliver no smoking messages all around the communities in town, and especially on sharing tobacco and picking up cigarette butts. The other issue we experienced was limited entry to organizations that were adhering to the physical distancing rules. We devised ways of continuous service delivery, especially the rehabilitation program, otherwise known as PRADC, and the schools by having our sessions outside instead of the usual small room that we normally use. And for the schools, it was quite easy because the schools had already set up the 1.5 meters for the kids. On World No Tobacco Day and Men's Health Week, that was a bit of a challenge because of the restrictions imposed by the government, which limited the number of gatherings. But to circumvent this, we went to the primary school to do some no smoking painting messages with the kids. And we posted those on Facebook, which the community loved. But we also did some in-class presentations at both the high school and primary school on the day, and we gave out some bags with some TIS messages in and out of the school. We also ran a quiz on Facebook for the rest of the community on World No Tobacco Day, and the winner got Break the Habit duffel bag, which had some TIS resources, including T-shirts, and a notepad, and everything else. On Men's Health Week, it was quite exciting because we got interviewed live on ACCC on the day. Yeah, so we actually increased our reach and actually featured in the local paper as well, and the school's newsletter. And as alluded earlier, we used the COVID-19 campaign to encourage smoking cessation in Tennant Creek. And since little is known about the risks of smoking and COVID-19, we just try to, educate the community to tell them that since the virus attacks the lungs and the chest, now would be the best time to actually quit smoking. Pregnant women were our main focus in 2020, but when the COVID hit, we just dropped bags, about 30 to 50 bags at the midwifery clinic. So we actually made an arrangement to form a yarning circle with the midwifery clinic to have regular yarning with the women there. But yeah, when Corona hit, we just prepared some TIS bags for them. We sent them out, and that was it.
don't forget about those activities that you couldn't do. I'm sure you won't, but yeah, they're great ideas there, Dan, and I'm glad to hear everything is going really well there in Tennant Creek.
Thank you.
Thanks a lot for that. And just wanted to have a yarn with Congress, and I think Donna is there that's going to talk to us. Are you at the pre-street meeting room?
We are. Hi.
Who have you got there with you, Donna?
So we have Jenna Pawley, the manager. There's me, the Senior Tobacco Action Coordinator. We have Emma Stubbs, who is our Health Promotion Officer. We're just trying to get her so we can see her. And we have Kirsty Hampton, who's just stepped out of the room for a second, who's also a Tobacco Health Promotion Officer.
Right.
So we've been really, really busy. We're in the process of recruiting 2 males to our smoking program, just to complement the delivery to our men, because it's a lot of resistance within our community from our men. COVID, although it's run ragged on us and tested us in more ways than we care to remember, it also allows us an opportunity to do the promotion around the prevention of taking up smoking. So we really used it as an opportunity to educate people around the harmful effects of smoking and really what it does. And I also quit smoking 204 days ago. So as the coordinator, I was able to share my story and really reinforce what the health promotion officers were relaying to our community. We've got some really good posters that we've been fortunate enough to share from Nganampa Health and MPY Women's Council. We use those as complementary resources to send to our clinic managers. Obviously with biosecurity, we were unable to get out there. And then we had communities that the board had determined to close their communities down to outside people, including essential workers like ourselves. So we had to use technology and send through the posters electronically, which our communities could then print off and put around. We went into town camps. We covered 10 town camps, 7 organisations around town that have a client base around the COVID stuff, but solely concentrating on the prevention of taking up smoking or quitting. We had 400 people educated in a period of about 2 weeks. And it wasn't just to spread the messages of staying safe and soapy. It was really around, you know, taking care of your lungs once they're damaged. We can't get that back. And really reinforcing, you know, the smoking rules around the town camps and the organisations that we were invited into. We couldn't travel, so obviously we needed to put something on our radio for our community. So we translated in language on the radio some of the messages around, you know, not only staying safe and soapy, but again, you know, if you need help quitting, Congress is here, and a lot of that was done in language. We had over 800 people return to country in a collaborated effort with the Tarntjeri Council, the Central Land Council and Congress. By bringing all of our resources together, we were able to put 800 community members back on the bush bus to their respective communities where they were safer during this period. Because while COVID affected so much and shut down so much, the one thing that remained open in our town, and it's probably like this everywhere, was the bottle shops. And so access to alcohol was readily available. So we just wanted to make sure that our mob got back on those buses and got back home where we knew that they were safe. World No Tobacco Day, we ran a competition where we invited our schools to put together some reinforced messages around no smoking, the harmful effects of smoking, and you know, if they needed to quit, where they could come for help. We had 5 entries, and out of those entries, we had 5 schools. Sorry, we had 4 schools and 1 individual entry from a Mumpa community next door to Ayers Rock or Yulara. And 2 of those schools were standoutish. One of them actually made a 3D packet of cigarettes, and in each cigarette there was one of the chemicals. So you could take out the piece of paper and open it and read it, and it was a chemical that was in there. They made USB, they made videos. There was testimonials on there from kids who would talk about their parents quitting as a result of the tobacco program going into the school. And it was Aralong Christian College that won first prize, but we also had a first prize for Bradshaw School as well, because they went above and beyond to create some really fantastic messaging. The competition meant that each of those schools are now, the prize is a colour fun run. So we, as the health promotion team in Congress, will supply all the powder, the fruit and the manpower to assist on that day, and the school just runs their event, and we're just there to, you know, take some photos and get that up on the portal, hopefully. But we're also in the process of organising a really big day out at Yulara in conjunction with Voyager's staff. So we want to go out to Yulara, and because a lot of the people that have come from interstate are smokers, you know, they might have left their family, so there is a lot of stress there. They could be drinking a lot, which then leads us to smoking more. So we want to go out to Yulara and really create an opportunity for the Mutijulu community to come in as well and do some education around, the smoking, the alcohol, the stress, all the stuff that goes hand in hand with smoking, because it all sort of goes together. So we want to go out there in October and spend maybe 2 nights out there just doing some education with about 75 staff members of Voyagers. Like everybody else has mentioned, we've been doing the work. We've been really, really busy doing the work that we just haven't had a chance to enter the data. And we are a newly established team. So prior to COVID, we had 1 staff member. So health promotions just sort of got in, and I was lucky enough. I'm so glad to be back too, Desley and Uncle Tom. It was good to come back to the program and really be able to establish a new team. While recruiting for these young men, I think we're really going to make our mark in Alice Springs and across the communities that we service. But our data just needs to be put in the system. We're doing the work, but there's just, there's a bit of admin that we need to take care of. So, but it's a busy time. I'm proud of the team and what they've done so far. We've put posters around town. We've tried to put posters in the back of our taxis and our minibuses. We've been given soap by Indigenous Eye Health that we've distributed in Congress bags. Thank you to the University of Melbourne. We've been proactive with, trying to get information out there about our smoke-free policies, especially within our own organisation, and then get out and obviously talk to other organisations about their smoke-free policies.
Wow, it sounds like you've been doing a great job out there, and welcome back to the team, Donna. It's good to have you back as well too.
Thank you.
Yeah, and of course, again, I talked to the new staff members just the other day, and you guys as well too. Welcome to the TIS family. I'm sure you'll have much enjoyment with the job as much as we do here too. Thanks for that, Donna. While I've got Congress there, I might just go straight into the next session. And the next session was we're going to introduce the new remote services teams that we have. And thank you to Congress, IUHI, Wurli and the Torres Health for being on the line with us, and we'll have a yarn with each of those individual services in a second. But I might ask you, Jenna, how are you going with this introduction of the new remote services there at Congress? And I suppose, obviously, what's your main focus? That's, yes, obviously the remote service things, but how do you think you'll deliver the activities a little bit different? Or
yeah, so for us, the new funding just gives us the opportunity to be able to get an additional staff member to go to more communities than what we were previously funded to go to. So we've added, I think, 4 additional communities.
Yep.
No, 5.
Nganampa, Yulara, Papunya.
Nganampa, Yulara, Docker River, Yuendamu and Papunya. So, and with some of them, we already have health promotion programs going to them. So we'll be able to build on relationships that they've already established. That's through the Red Tails, Pink Tails, Right Tracks program that works with the sporting clubs. And then the team have already kind of started some of those relationships as well with Nganampa and Yulara, because Yulara was already so closely linked with Mutijulu. So we've been able to build on that further and be able to put more of a focus on those, because you've got quite a big Indigenous population out at Yulara that work out there. So we're able to put a bit more focus into delivering sessions to them. And then Nganampa, we got them involved in the World No Tobacco Day program. Even though we hadn't signed this new contract, we knew that they were coming on board. So we've been including them in. So and activities that we've already been doing, like we've already had a big focus on reaching more than just our communities through our social media and our TV ads and our radio ads, because we use channels that reach not just specific communities. So it just allows us to be able to put more focus on those areas as well and more funding into that.
So that's good. Well, the good work that you're doing currently with the programs to stretch it out to those new communities that you're doing. That sounds like a good idea. If it's working well, don't break it. Yep.
Yeah.
Thanks for that, Jenna. If anyone has any questions, don't forget to use the chat room to the teams directly if you want to ask any questions or anything. I'm going to ask Nathan how he's going there. Before I do, Nathan, I have seen people hovering around there, and I think Patrick has been there. Is that him? Is he close by? Does he want to say hello?
That is Patrick. I'll grab him maybe after we have a chat. Actually, do you want to say hello? Everyone wants to say hello to you. Hello, how you going?
Hi Patrick, how are you going there? Do you want to say hello to all the teams in the Northern Territory?
Hey guys, how you going?
They're all missing you, I think.
Yeah, I'm missing everyone in the Territory, but I should be up there soon, hopefully next week, hopefully. So hoping I can catch up with a lot of people as well.
Very good. Cool. Keep up the good work there.
Thank you. I'm looking at about 50 screens here, so I don't know who to look at. Keep up the great work, guys.
Yeah, see ya. So Nathan, you've got a bit of a different kind of a setup there too, because IU is based in Brisbane, the Deadly Choices, and you're working on Tiwi Island.
Yeah, so I've got Tanisha Duff who's going to give us a bit of an update.
Okay.
And, just some sort of intro, and then we'll sort of chime in where needed.
Yeah, absolutely. So if I can just introduce, you guys know Nathan. We've got Luke Dumas, who's online as well too. He's really our tobacco expert in the team. So what we've done is actually built on an existing partnership that we had with Essendon Football Club, AFL, and the links that they have with the Tiwi Bombers. Now, I have no idea about AFL, so I'll have to apologise to all of you because I live in NRL land. But we're kind of, maximising access to the players there to really push out a lot of our social marketing and using the players to do a lot of our messaging, our public health promotion. So through that partnership with Essendon, and we're working with them at the moment to do a launch next week, actually. So anyone in and around the Darwin area will probably get in contact with you to come along. I think there's going to be a long walk on the Friday, and then at the game on Saturday, we'll kind of, launch the partnership, and, we've got great access to the players, so we can get them to do some of our, quit smoking campaign stuff as well, which we're very happy to share with you guys here if you think it's going to work in your community as well too. So through that partnership, we're really funded to employ one worker on the ground. With the partnership with Essendon, they have 2 community workers. So we're going to have a little team of 3 people that we can train up. At the moment, we're trying to work through the logistics of, because I think the restrictions from Brisbane, particularly being a hotspot, has just been lifted. So we can actually come to Darwin now, which would be great. So the guys are going to be up there next week, really connecting in, with Danila Dilba. We've got links there with ex-DC Deadly Choices teams. So we'll try and build a bit of a network between the Tiwi guys and Darwin, because there's probably a lot of movement anyway, with Community Mob going across. So I mentioned the launch of the partnership next week. We've also established a memorandum of understanding with the NT government, particularly for their clinics that are on the Tiwi Islands to, have community members either referred and or making sure they can, have access to the health checks and get, Deadly Choices shirt if they get a health check there as well too. And, while David was talking about, the NT, I was having a look at the NT policy, the NT Tobacco Action Plan, and seeing how we align and what our intentions are over the next, 3 to 6 months and 12 months. But it really is around, that media campaign, making sure we've got role models who are delivering messages that are going to resonate with communities on the ground. We're going to focus on, the partnerships and establishing a lot more smoke-free spaces, so in the homes and the workplaces. And then we'll, start to focus on a little bit more once we've, got a bit more of a presence there around, referring people to quit smoking and targeting particular priority areas. But I'll just pass on to Nathan. I don't know, Lucky's there, or Luke as well too, if there's anything else that I've missed out.
Yeah, no, Danisha, I think we've also, we're in the process of creating an online training platform as well, so which is going to support our team in the Tiwi Islands as well. Like I said, we've got the launch of Darwin, the Dream Home game,
utilising play to send out messages is really important. Just a few stats. With the COVID period, obviously it was difficult to deliver programs, but we were able to create some really exciting content on our online platforms. For example, for our World No Tobacco Day, we had a reach of 64,000 people. So we were able to, we had I think it was a 67-hour long World No Tobacco Day live, using Tom, Desley and other community members from around our licenses. So Donna was having to jump on there as well and pre-recorded a live, just talking about their stories and impact within the community around telling their stories. So yeah, we'll be linking in with the Tiwi team and utilising this online social media platform really strongly as well, and hopefully giving a strong voice in the community as well. So being able to tell their story, to do a lot of education with the Essendon Football Club and players as well. So it's obviously very exciting.
Thanks, Nathan. Lucky, did you have anything to add?
No, I just thought I'd put my face on the screen as part of the crew. Since this thing started today, I've been under Luke, and I've been pondering what mischief I can get under Luke's name, and I've been very well behaved. I had grand plans of writing, bad things on there and getting Luke sacked so I could take his job.
Yeah, because I was going to say, boy, Luke has changed a lot since I last saw him.
I just look forward to this is really exciting, and I just really look forward to within what I can do to help contributing to the cause up there. That's what I can say, and the boys, I'm sure, have got it in good hands.
Very good. Thanks a lot for that, guys, from IUHI there. Okay, the next one is Peter. Peter, how are you? You seem like you're a long way away, and you're in Katherine at Wurli.
That's right. I'm here at Wurli, and the CEO, Susie Berto of Wurli. She's going to start off.
Just a big hello from Katherine, everyone. As you know, we're located in the Northern Territory. We have 3 major AMSs operating in this area. Wurli is the main AMS for the Katherine region. We operate within a 40-kilometre radius. Our origin is from the Danila Health Service, which was implemented back in the 1980s. So we've come a hell of a long way. We hope to celebrate our 40th anniversary within probably the next 2 years. We have a board, a governing board of 14 members from the respective communities around the area. Our clientele, our population in Katherine is about 10,000, with probably 4,700 of those being Aboriginal people and Torres Strait Islanders. We're really looking forward to rolling this new program out in Katherine, and I want to take this opportunity to say a big thank you to the Australian Government, but especially to Professor Tom Kelmer for his support in us being awarded this program. I'm going to hand it over to Peter, and he'll talk to you about how we intend to roll it out. So, you know what? Looking forward to working and joining this TIS family.
Oh, thank you. Lovely to have you on board, and lovely to hear from you. Thanks.
Yeah, so we're very lucky to get Jessica on board as our TIS coordinator, and she'll be starting with us very soon. What I've heard this morning with Professor Kamler talking fits in with exactly what we want. We want to actually upskill the staff in Wurli, which is one of the main things, so that they've got access to the clients, but without that upskilling, then that message doesn't get across to change behaviour. So we do well at recording how many people are smoking, and we've got like 60% of our clients smoking. So we've definitely got a challenge to get that down. We've also got the challenge of integrating into the other organisations around town and getting out of the health service and actually trying to work and get the organisations smoke-free, one being our own, working with our staff that still smoke in the organisation and get those smoking rates down, but also other organisations, and then just working generally in the community. So it's interesting and it's going to be exciting, and yes, I think we're lucky that we've got Jessica that's already got runs on the board, and she'll be able to help lead us in the right direction. And we'll be recruiting soon, so if anybody's looking for a job, watch out for our adverts at Wurli. It's a great place to be in, Katherine. Thank you.
Thanks so much for that, Peter. And if you like, we can put that advertisement for you on our resources. You know, the Health Infonet website, as well as the Yanning Group page as well too, if you like. But I'll contact you later about that. And we have Paula from the beautiful Torres Straits, Thursday Island. Hi, Paula, how are you?
I'm very good, thank you. Thank you for having me join the NT Forum. And likewise, we're thankful and grateful to be included in the TIS family. We are a new site, but we're also a very new health service, and it's the first of its kind in terms of community control in the Torres Strait region. So we've had some significant milestones over the last 12 to 18 months, and part of our development was strongly around preventative health and health promotion strategies. So we've been able to develop a unique volunteer-run health and wellbeing programs in the community by supporting local people and local mentors to be the volunteer facilitators and leaders for that. So our Tackling Indigenous Smoking program will launch off and support some of that work that's been happening around that fitness and wellbeing type programs. We're currently in the process of recruiting. We have made offers, so we're hoping that those 2 staff members that we've been fortunate to get funding for will commence in the next 2 weeks. So we're looking forward to hitting September, implementing our activity work plan. So in the Torres, we have 17 islands that make up the Torres, but we have these 4 inner islands, which are considered Kara nations, and they're Aboriginal lands. So we have Aboriginal lands as well as Torres Strait lands or communities. So our key role is to make sure that we're transferring and transitioning our knowledge and all of the evidence that we can learn from what you have already established, and it was great to see some of that on today's data and evidence and some of the innovation that you guys have shared with us today. So I was like madly taking notes so that we can support some of that. And I think the other key to this is that we have quite a lot of Torres Strait Islander families who live in Darwin and across the mainland and within the territory. So we're hoping to partner with you guys around some of that transitioning or transferring of language into Torres Strait Creole and some local languages, so we might be able to do that. While we've been doing the recruitment process, we've probably looked at what we can do, because we did focus on tackling smoking as part of our COVID strategy locally, and we worked closely with IUHI to develop a family plan. And some of that family plan was to go in to build strategies and measures for families who may possibly be in isolation. Take into consideration some of that, the impacts that they would have inside the family. And I think this goes to some of that stuff that David was talking about in terms of stress and anxiety and so forth. And why we did that was because we have a really good relationship and partnership with IBIS, which is our big retail stores for all of our remote communities. And we saw a significant increase in tobacco sales. So they brought that information to us so that we could partner with them around what were some of those impacts. And we used that family planning tool when we went into our families around preparing and readiness for COVID impacts. So that was where we've been able to further develop that relationship with IDIS around what are some of those strategies that we could work together around supply reduction of tobacco sales in some of our remote communities, and what are the strategies that we could do around that public health messaging. So they're keen to step up. And we've also engaged the 2 councils that we have. So we have a Shire Council and an Indigenous Council. And part and parcel of that was to look at all of their smoke-free policies. So we have 39 organisations that kind of within the TI, which is kind of like the capital city of this Torres Strait region. So we have 39 government and NGO, not-for-profit organisations based here. So that was a perfect opportunity for us to start engaging with them around their smoke-free policies, and then how we could support them around workplace strategies around the reduction of tobacco and smoke-free processes. So we've also developed a relationship because, again, we have a regional area, and Thursday Island is that hub. So we have extensive boarding hostels. So we've been working with Aboriginal hostels around how we can work with them around supporting people coming in for whether they're coming in for healthcare, whether they're coming in as student boarders. So we've been able to get innovative work happening with each of those different target groups around that. In particular, we've been working with the hostels that accommodate our pregnant women who come in from the remote communities. So they have some unique strategies and some innovation that we're going to partner with them in terms of taking that opportunity while we have them coming in for maternal health services. We'll focus with them on that strategies around preventing smoking and secondhand smoke and all of those impacts. If I could just touch as well, we have done some work on our Communicare. We run Communicare as our electronic health record as well. And we've used the IRIS screening tool, which is the social emotional wellbeing tool. And we've added a couple of risk assessment type criteria for us to make a referral pathway around that stress-related answer to tobacco use, so that our tackling Indigenous tobacco smoke workers can then follow that up as an internal referral around their social emotional wellbeing screening. We've been doing some work with IUHI. We've got some innovative thinking that we're working with Nathan and the team there around our, like everybody else, we're a biosecurity hub in terms of COVID-19 impacts. And some of, we've got some sports profiles from our region as well. Some interstate, some internationally. So basketball and rugby league are the 2 big things that happen up here in terms of health promotion and messaging. So we're looking at innovative ways on how we can keep our remote communities connected through possibly not being able to go down to the Murray Carnival or something like that because we can't travel. So we're now looking at how we can do that online, like through Xbox and PlayStation and some of those platforms, so that we can have like mini competitions between the islands. So we've been doing some development work there with Nathan. That's pretty much us. Thank you, Desi. Thank you, Tom, and thank you everyone else for having us.
Thanks a lot, Paula. Thank you so much for that. Paula's actually the CEO there at the Torres Health, and thank you for taking the time out just to have a yarn with us as well too. That's fantastic. Thank you everyone for your feedback today. What I heard is, this COVID stuff has although we're working at a distance, it's sometimes just bringing our teams closer together. you know, because we are in a confined area working from home, but, you know, we have a bit more communication with each other. I know that we've learned a hell of a lot more about our IT and how it works, that's for sure. And it sounds as if we've ramped up of course, the social media side of things and the development of resources, which is really, really good. Just want to mention before I finish up here again about the Northern Territory Tobacco Action Plan. You know, that's a good idea, Denisha, how we can just have a look at that and how we link it, you know, into our activities, and of course, how we're all working together in all of this. So I might hand over to you, Max, or go straight into Professor Kalmar's closing remarks.
I think we might go straight